This is Healthline on Base 101.1 FM.
Last week, Thursday, I was super excited because one thing is for sure is Chacha, the happy fairy, hardly goes to the doctors. And now, all of a sudden, she has doctors coming to her. I feel so special. I feel amazing. Again, I have a doctor in the studio, and I feel very happy because when they say, the last doctor that was here said, you need to see your doctor every day, every time. Now I get to see a doctor every Thursday. Who knows? I would just be bringing my life problems here and having them solve it for me for free. Welcome to the show, Dr. Williams. Good to have you.
Thank you so much.
Good to have you here. First of all, I want to know something. When they say doctors, there's a certain type of pride that comes with it. When someone says, I'm a doctor, right? You feel very proud when you tell people you're a doctor. Do you introduce yourself like that every time?
I hardly introduce myself as a doctor. I just go straight and say my first.
No, if I were a doctor, I'll be shouting, I have a tattoo on my forehead, say doctor. How does it feel being a doctor? Every time the people come to you with their problems, random problems, and you're like, please come to my hospital.
Oh yeah, so people do. I mean, like, you always have people expecting you to respond to messages, calls. Doctor, I'm feeling this way. What do I do? What can I get for my friend or for? So there's this constant request and this constant, expectation. Really. Yeah.
If I were a doctor, I'll be so proud. Oh my goodness. Anyways, my family, they say I'm a doctor sometimes because if something is doing you, you ask me. My friends too, damn, I'm feeling this way. I always have something to say. Now I'm gonna add to my portfolio as a doctor intern. Are you offended by that?
No, I'm not.
Good, of course. If you were, there would have been a problem. So there's something for sure. A lot of people feel like they're safe at home. You should only know some certain things if something is wrong with you, right, health-wise. People don't really understand that there is something important in every household, and it's about first aid. In your knowledge, with your knowledge, why do you think it's important for every household to know, first aid?
Well, it's very important, first off, because that's usually the first response to any healthcare issue in the home, right? Right before you get to call like any health practitioner, or you can take your relatives or loved one to the hospital. So there are a couple of things that are needed to be like in a first aid kit. So you need like the cotton wool, the gauze, the spirits, Dettol, that's disinfectants. You need the medical scissors, not the usual scissors.
Not the one for lashes and lace.
Then, of course, you need gauze.
What's gauze?
So it's like, how do I explain it in layman terms? So it's something like a cotton wool, but it's definitely
okay. It's like
wool.
Net.
Yes.
Okay, right.
Exactly.
Okay.
Right. Then you need some medications at home as well. You need paracetamol. You need the oral rehydration solution for people who get to experience vomiting and diarrhea.
Is that sugar, water, and salt?
Like
ORT.
So it has some electrolytes in it as well. Okay. Then you need the ibuprofen, which is still an analgesic compared with paracetamol, right? And basically these things are very important and needed at home. Then you need a clean cloth, for cases of bleeding and all that.
So I have a whole basket of so many things, so many random things.
So all of this should be like, packaged together and kept in a safe box.
Yeah. I have a big basket of a lot of things that sometimes when something is wrong with me, the first thing I do is Google. I say, okay, what do I need for that? Then I go take my basket of medicine. I was going to say drugs, of medicine, and I check what's there. I end up looking at I'll see through my scene or something, and I Google. I say, what is this used for? Now, what would you say some of the common emergencies at home you've witnessed, you've seen, or personally that could happen in the household that we don't really think about till it happens?
Okay, so there are a couple of them. You think about the tiny cuts or the laceration, as we call them, but cuts. Think about people who choke, probably eating or drinking or whatever. So choking. You think about fainting, convulsions, right? That's usually very common in children less than 6 years of age. Then you think about asthma attacks for people who are asthmatic, and then fever, difficulty breathing. It varies.
Right. So I've You know when people used to say before that I fainted, and before I used to feel like, no, I've not done it. I felt left out.
Has it ever happened to you?
The only time I remember fainting was when, so I was much younger and people were playing outside. So I wanted to go outside, and then I saw some small fine boys on the road, and I said, let me just cross across the road, also walk past, as you know, and bicycle hits me, and then I find this gutter. And the only thing I remember is, that I remember waking up and I considered fainting. The only other time I probably passed out. Oh, no, I didn't faint. It was on a basketball court, and it felt like my lungs closed. And when I was taken to the hospital, I was told that it was a panic attack.
Right.
But in the household, I've never really had any emergency. But I've had situations where, say for instance, my sister recently stubbed her toe and she was bleeding real quick. My sister has low blood sugar or low blood, but she always needs to top up. She takes bitter leaf and blood tonic and all of that to increase her blood level. For someone like that, if she had hurt herself or cut herself badly in the kitchen, she doesn't cook, but if she had cut herself badly in the kitchen, what are those steps that she needs to take?
So immediately she needs to get the first aid kit, right? And then get the clean cloth from it. First of all, she needs to quickly wash her hands.
Okay.
To just make sure she doesn't put in more germs into the wound. And then after that, you get the first aid kit, you get the clean cloth, apply pressure on the wound. Right,
Okay.
You have to apply pressure consistently on the wound for a couple of minutes, say 5 to 10 minutes.
Okay.
Right, so all of this depends on how deep and how large the wound is. But if it's a tiny one, you just apply pressure and watch if it's still bleeding. Right, then after a while, after 5 minutes, you can remove the cloth and watch if the bleeding is still there. Of course, if it's not too much and if it's not too deep, at this point the bleeding would have reduced drastically. Then you can now go on to use the cotton wool and clean the surrounding of the wound with your Dettol or spirit, just to disinfect it, and then use a bandage to cover it up.
So what if you don't apply pressure? It doesn't stop the bleeding.
No, so for the most important thing when it comes to bleeding is applying pressure.
I didn't know that. I've learned something new today, because normal me would just say put cotton wool on it and just put a plaster on it.
Okay, no, so that won't work.
Okay, what about cooking burns like hot water or hot oil? The first thing that I would do if hot oil poured on me is to put my hand on that running water.
Right.
Is that correct?
Yes.
I thought you said I'm a doctor. I know it today. So how do people handle minor burns or scalds from cooking oil?
So just like you said, first thing is to immediately you make sure you do not apply any contact to the affected area, right? Because that could immediately cause the skin to come off.
I thought that regardless if you get burned, the skin will still come off.
Well, so not compared to if pressure is applied to it.
Okay.
It's different in a way. You could peel off without pressure, right? Subsequently, depending on the depth of the burn.
Right.
But if pressure is immediately applied to it, it's going to look entirely different from what it would look like if there was no pressure applied to it.
Okay, the last one that I want to know specifically about is about nosebleeds. A lot of people have experienced this. What is the first thing you do while you're home and you're experiencing nosebleed?
So you want to sit up immediately, and then, with your head forward, you quickly pinch the soft part of your nose.
Okay.
Right, for 5 to 10 minutes. You want to pinch it continuously.
Okay.
You don't try to remove your hand and see if it's still bleeding.
Oh, okay.
Right, so you put your hands there on the soft part and then pinch it for 5 to 10 minutes, after which you gently remove and see if the bleeding is continuous. If it's still bleeding, then you have to go to the hospital.
All right. Again, one more before we take a break. What is the craziest thing you've seen or emergency from the house that has come to your doorstep?
Well, I think the craziest thing I've seen is people's response to emergency situations.
Yeah, what's it like?
So, I've seen a baby present to the ER with, a lot of things stuffed into her mouth. Palm oil, onions, right? Palm oil, onions, and a whole lot of, I couldn't even explain, the scent was so horrible that
you thought they were about to cook the child.
Right.
A little seasoning here and there would have been yummy.
So You don't have to do any of this. I mean, that made the situation worse.
Is it?
Yes.
So the thing about taking palm oil when they say you feel like you might have been poisoned, is that correct?
No, it's not.
Please, I need you to say it again.
It is not correct in any way.
So palm oil does not stop poison?
No, it doesn't. Please. So, I mean, first of all, you have to identify the source of poison, right? And then if you can, you get the container or whatever it is and take it to the hospital.
Right. You know what? We've been drinking palm oil. A lot of people have been drinking that. So Dr. Williams has told you, palm oil does not stop poison. So stop. Palm oil is expensive now. So let's be guided. A lot of us don't realize that we need to have first aid at home, and we just go about our lives. Say nothing will happen for us, but it's to shock you. The day it will happen, nobody would tell you. That's why we're here, to express and tell you things that you need and how to, take care of yourself. For the next 15 minutes, we still will be talking about some setting things. Now, we've spoken about cuts, we've spoken about burns. I would love to know, doctor, you mentioned earlier on about choking is very common.
Right.
Now, choking, normal. If somebody's choking, the first thing that you hear is slap them on their back. Let them be okay. But what should someone do if a child or an adult is choking? Are the techniques different for?
Definitely.
Okay, so what do you do for a child?
So for a child, you want to face the child downwards, face the child down,
right,
with their face looking downwards, and then place the child on your hand, right, and then when the child is in a proper position, you apply 5 thrusts to the back of the chest with your palm, with the base of your palm, 5 times. And if the child continues choking, you turn them upwards towards facing you, and then go on again and do the 5 chest compressions.
Okay, like turn
the entire aspect of the chest.
So backwards and forwards.
Yes.
Okay. All right. So what if for an adult? How do you handle choking for an adult?
So for an adult, you stand behind them and form a fist.
You'll punch up.
No. You side behind them, form a fist, and then place the fist slightly above the belly button.
Okay.
Then hold the other hand with the free hand, right? And then apply 5 abdominal thrusts.
Okay.
Right? You have to keep doing it till the patient, why am I saying patient?
To the person now.
Right.
The person choking.
Exactly. Till they feel comfortable, so they start breathing well. So you have to do it continuously.
So
you don't do this to a pregnant woman.
Oh, okay.
For people who are really obese, so you have to do the chest compressions.
Chest compression for.
So instead of placing your hand slightly above the belly button, you place it on the chest.
Okay, so the baby no go.
That's for the adults.
For the adults. Okay,
yes.
so the back hitting when someone is choking is only for kids.
Kids.
Okay.
It's not like hitting. You're just applying pressure on the back of the chest with the base of your palm.
Okay. Now, there is something that happens a lot of times. People say they just had a heart attack. They say a heart attack is really quick, is fast. A lot of people don't know what to do at that time when someone seems to be having a heart attack. How can you tell when a person is home, chilling, and a heart attack is setting up? First of all, what would you say causes that? And secondly, how do you see signs that this is a heart attack about to happen in your household?
Okay, so there are myriad of causes for heart attacks, right? The most common is what we call ventricular fibrillation. So these are when the situation where there's an abnormal conduction of electrical impulses in your heart.
Bring them down, Ross.
So usually the heart has its own produces its own electricity, right, to cause the contraction and the relaxation. Okay. So for whatever reason, if anything disrupts the pattern of the contraction and the relaxation of the supply of the electrical impulses, that could cause. That's the most common cause of heart attacks, right? Okay. So when this happens at home, the first thing you want to do is to immediately place the person on their back, lie them on the floor, on a flat surface, right? And then, of course, with them facing upwards. And you check if they're breathing, check if they're responsive, try to call out their names. Hello, can you hear me? Check if they're breathing, check for a pulse. Okay. And you immediately call for help. Okay. So immediately you do that, then you start the chest compressions, the CPR, the cardiopulmonary resuscitation.
Okay. So how do you know that this is a heart attack happening? What are the signs that shows that that's what's happening?
So sometimes people just start complaining of chest pain. They might immediately complain of chest pain and then become unresponsive. Okay. right? So you call them and they don't answer, they don't respond.
Okay.
The breathing is just abnormal. Usually between the first few seconds of it, they might gasp. You see them gasping for
air.
Yes.
Okay.
So you just know that something abnormal is going on.
So is getting a stroke also preventive? And also, does heart attack have a time frame or an age frame? Can it happen to anyone, or is there a specific age group that can have a heart attack just by doing nothing, being home, sitting down, and it can happen? Is there an age group?
So for just sitting home, and it's more common in the elderly people who have associated comorbidities.
Okay.
Right. So maybe the person has been, hypertensive for a long time, or some people just have, cardiac arrhymnias, what we call arrhythmias, whereby they just have an abnormal conduction in the electrical pulses of the heart.
Hey, doctor, you want to scatter my head?
Then there are a couple of causes, or they have myocardial ischemia, but there are risk factors.
Okay.
Right. There's risk factors. Hypertension, diabetes, smoking. So there are risk factors. And so that's that for elderly patients.
Okay.
But for younger people, there are certain causes, maybe drowning and a whole lot of other things.
Okay. So how do you help with someone who might be having a stroke while at home? Some people say that it's better to treat them at home before you rush them to the hospital. How do you do that? You just rush someone to the hospital if you think they're having a stroke?
So usually people wake up and you notice side of their face is sort of drooling. It's not like there's an abnormal symmetry, or they can't raise their hands properly, or their legs, or any part of their body, or they have a slurred speech.
Right.
What you want to do is just take them to the hospital.
Straight. So how do you know when it's time to leave this from first aid and just rush to a hospital? Where in Nigeria, a lot of people have abused drugs.
Right.
A lot of people feel, even in this day and age, some people feel like ChatGPT and AI apps will help you. So when should someone drop trying to sort themselves at home and head to the hospital?
Okay, I think the most important thing is to understand that first aid cannot take the place of hospital treatment.
Right.
What it does basically is to offer, critical care, first response care to injuries at home. Right. After which, if depends on the cause. Of course, if it's something that can be managed at home, then the person can go on and do their stuff at home. But most cases, you have to always take them to the hospital to get proper evaluation, screening, and then continuous management.
Right. So I'm just going to say, for instance, I remember sometime 2 years ago, I had an accident. It was bad, but I came out unhurt. The only thing that was bad was my toe. My toe was bleeding.
Right.
The car I was in was upside down. Now, it wasn't in the country, and the ambulance came, and obviously I didn't have health insurance abroad. So my in-laws just said, you know what, take her away from the scene. And I left my friends who had the work permit, visas, and they were citizens at the scene. And they got checked by the ambulance. I didn't. So days later, I was, using Cocodamol. I was on heavy medications. And it took a couple of days. Someone said, you know what, we need to take her to the hospital immediately just to check. And the doctors checked me and they said, I was fine. I just need to continue with the drugs. Now, say if someone has an accident, what do you think, when do you think the person should go get checked? Do you think immediately?
Yeah, immediately.
Okay.
It's very important they do that.
Okay.
Because in most cases, some cases, actually, there is no physical injury, and there may be something serious going on inside,
and the person feels normal,
and the person would feel normal for the first couple of minutes.
Okay.
Right. So what you want to do is go to the hospital, explain the situation, like the process of the accident or whatever, and get it properly evaluated. You don't want to take chances.
So we did speak about choking in infants and adults, and now in elderly people, are there special considerations while treating them, during first aid?
For choking?
No, anyone.
It depends on what we're treating in this.
Okay. So burns, is there anything special? It's still the same way?
No, it's still the same. Put it under running water for about 10 to 15 minutes.
Okay. So what are some child-specific emergencies parents should be prepared for? Someone has said toddlers always try their best to unalive themselves.
Yes.
So what are those specific things new parents should be looking out for?
Okay. So one of the most common is foreign object aspiration. They usually crawl around the house and can pick up anything and throw into their mouth, or even into their nose or into their ear.
Oh my goodness!
Right. So in situations like that, the first thing to do is also to just take them to the hospital.
I've seen a situation where I don't know if it was recently, where a child swallowed battery.
Right.
And that's
they do swallow a whole lot of things.
What is
like tiny nails, battery, beads, earrings, and so on.
Have you seen that?
Yeah, sure, definitely.
Did you scream? What did you? The last one that happened, what was it like, and how did you handle that?
I looked at the baby. I'm like, I'm sure you do not understand the danger of what you just did.
Goodness.
But then, but it was a case of battery, of course.
Battery.
Swallowed about 3 of them.
3 batteries.
Yes.
Small throats.
Yes.
And how did you handle that?
Oh well, so in that situation, you usually refer to, if it's causing difficulty breathing or if it's lodged on the throat, right, it needs to be taken out. So you do the initial resuscitation, stabilize, and then the specialist, the ENT specialist or whoever it is, takes it up from there.
Right.
So usually they use something called a bronchoscopy, or like a tube with a camera attached to it and some tiny fragments that can clamp, like, and hold stuff and then bring them out.
Oh my goodness, that's not a sight that I want to see. I'm already cringing. Now let's talk about CPR and basic first aid. Do you think every adult should know CPR, basic CPR?
Yes.
And what is the crash course you can give us on CPR?
I think it's very important for adults to understand the basic steps in cardiopulmonary resuscitation. It's very, very important because it could improve somebody's chances of survival by like 3 or 5% compared to the situation where nothing is done. Okay, and so the crash course here is for you to always understand that when something happens, let's say for instance you are at a station and then somebody just slumps immediately, right? You want to make sure that the environment is secure. That's the first thing. And then the second thing is to immediately assess the patient, like the person, check how responsive they are they breathing? Then you check for the pulse.
Right.
Now usually the teaching is you take 2 fingers, the index finger, that's the first and the second, and you place it beside the neck, just immediately under the skull.
Let me see.
Yeah, right there. Yes. And then you try to feel for a pulse.
I'm alive.
Right. And after that, you want to call for help. You want to call other people in. So it makes it a whole lot easier if everybody understands what the basic, life support is all about, the cardiopulmonary resuscitation. So after that, if there is no breathing and the pulse is in there, you start the chest compressions immediately.
Okay.
So you place the base of your palm on the chest.
Okay.
Just slightly above the gap between the stomach and the chest.
Okay.
Right. You place it there, and then you place the other palm on it.
Yes.
Something like this, right?
Okay.
And then you start applying pressure on the chest.
Not too much pressure to break the rib.
Well, in this situation, it's better to apply enough pressure than to not apply.
Okay, all your power. So you said you guys chop before you do that.
You see, so you do 30 chest compressions, and then if there is medical equipment called an ambu bag or something you can use to give breath to the patient. You do 2 breaths and then 30 compressions. You keep doing it until help arrives.
So, real quick, when is mouth to mouth necessary?
In this situation it is, but if, like I said, it's just at the station, you don't know the cause of.
Okay.
So if you're comfortable with that, that's fine. Right.
Okay, so what are the common mistakes you've seen people make in an emergency? We spoke again. I'm going to bring that back. Before you answer, you've already said palm oil.
Yeah.
So people are always using palm oil for poison. What are your thoughts on that?
So, first of all, we have to understand that palm oil is not a neutralizer, right? So, and in most cases, because, say I'm having abdominal pain, take palm oil. So, it doesn't really cure the cause of the pain. So, in a way, it slows the treatment, the medical treatment. It slows it down because
it worse?
It's not like, so first off, somebody has an abdominal pain, you do not even know the cause of the abdominal pain. And instead of assessing care, you go on to take palm oil, and then of course you have to wait for it to work and see if it's going to work and all that. So that can slow medical care. Secondly, people can aspirate on it. Why do I mean it can go to the wrong,
is it
to the trachea and then cause aspiration and all that and cause its own issues. Then thirdly, it makes it worse in the sense that it makes it very difficult for the medical doctors or the practitioners to assess the chemical or the whatever it is that was taken in case of an injection of poison.
Oh wow.
So now it's mixed with something that you're not even sure what it is. Right? Okay, so it doesn't help.
Okay, we've already stamped that one out.
So
no more palm oil.
Help, yes.
So the only thing you should use palm oil for is to cook.
It's just to cook.
It's just to cook.
Yes.
But what are the common mistakes you've seen people make when trying to help in an emergency?
So first off, it's very common for people to panic. You want to stay calm. You want to, if you panic, you're going to waste a lot of time. And secondly, in the case of like fainting, please, why are you pouring water on somebody's face?
You don't pour water on somebody's face when they faint.
You want the person to breathe. So why you right? Unless the person passed out from like heat exhaustion.
Okay.
They've been running or been active for a long time. So you want to like cool the temperature down. But when is the situation of just somebody walking and they faint, why are you pouring water on their face?
Oh yeah. What do you do then?
Okay, so like I said, the response, you stay calm, and somebody tries to secure the area, make sure the patient is well placed in a flat surface, and the crowd isn't too much, and a lot of air can get to the patient, and then somebody else can take up from there, check for the patient's responsiveness. Somebody else can call for help, like try to get an ambulance or a car to take them to the nearest hospital. And if the person closest to the patient has assessed for breathing and the pulse, they can start the chest compressions while all the other arrangements are done. So there's no need for everybody to start panicking and running around, start giving palm oil, bring this, give water and stuff like that. So it usually doesn't help.
I'll be so mad if I fainted and woke up with palm oil all over my face.
My
I'll just ask for bald yam.
You don't want to faint at the wrong place.
Oh my God, I'll be so pissed off. Like, especially what if I even had my face beat? Do you know how expensive makeup is? Imagine if I had put
and some people can actually beat you, like in the process of trying to wake you up. Right.
Why are we like this? So they should bring water, pour water for your head. No, we shouldn't do that. Lagos, in the era, please stay no. Let's take a message here on WhatsApp. It says, what is the most important first aid skill and equipment everyone should know and have? That's from V.
Okay. So that's a very good question. The equipment here, I would refer to it as the first aid kit. So you need a box, something. You can get a box. And then you get all the requirements. Get it packed and arranged properly in there. So like the cotton wool, the gauze, the disinfectants, could be Dettol, spirits, Savlon, iodine, right? Then you get the plaster, you get the crepe bandage. Get a Neurogesic cream, which is these creams that when you apply on it, it gives sort of like feeling. Yes, okay. Right. Then you get the scissors, like I said, plaster, and then some medications that are needed at home: paracetamol, ibuprofen. You get oral rehydration solutions, right? And all of this, you have all of this in a box. Right. That is the first step. Okay. So and then you have a clean cloth, right, arranged in the box. So all of this will come in handy depending on what the situation is at the time.
This second question. It says, can you suck out snake venom like we see in movies? And is it actually effective?
Yes, I would say it's effective. But when it comes to venoms, I think it's best handled by professionals.
Before you go drink.
So what if you suck it out and mistakenly you swallow it?
Ha! Double wala.
Right. So it's usually in that situation, of course, you want to quickly take the person to the hospital.
Oh, wow, that's a lot. Thank you so much, doctor. It's 20 more minutes before we clock 10. Real quick, what is one thing you would love listeners to take from this conversation, or a health tip that you would love to drop?
Okay, so first, the most important thing is, I think I had this conversation with someone yesterday. If we all could, we all have internet connection and we have, smartphones. Go to YouTube, browse for BLS, watch the video, practice it with your friends.
Okay.
It can come in handy at any time.
What is BLS?
That's the basic life support.
Okay.
So this is what first responders do in cases of, someone has a cardiac arrest or someone is unresponsive.
Okay.
I think everyone should understand that and know how it works. It's very important and it's life-saving.
Life-saving.
It can come in handy for your friends, relatives, or even a stranger.
Thank you so much.
And then, of course, we should all have our first aid kits at home.
First aid kits. Real quick, this is a question from me. A lot of times people have had cuts, injuries, and there is no spirit or Dettol or whatever around. Can you use alcohol like spirit or gin or Hennessy?
So again, it depends on the. It's usually better for
tequila.
You to use a disinfectant.
So
right?
what about?
Because these things, yes, they have some alcohol in them, but it is not 100% alcohol.
Okay, I've also heard people say spray perfume on it.
Good.
No vest now. No vest. Spray perfume. There's alcohol in perfume. So
no, please, you don't want to do that.
You don't. Okay. Yeah. All right. I saved someone today. Thank you so much, Doctor. If you want, how could people find you if they want to get through to you?
You can check me out on Instagram at I Williams Walaka, right? Yes.
Okay.
Dr. Williams. That's the full stop. Williams.Walaka.
Somebody that said I knows to introduce himself as doctor. Look at his social media. Dr. Deja.
That's my professional page on Instagram.
Okay. Yes. He got multiple. Thank you so much, Doctor.
You're welcome.
And a pleasure having you. Hopefully another day you would be here.
This is Healthline on Base 101.1 FM.